Hello, I'm Tiffany Bombard, and I'm here to talk to you about the Epistaxis protocol. Before we even get started, I want to direct your attention to this here, which is the website that allows you to give us input about protocols. So the last few protocols that have come up have been directly from suggestions of EMS providers. And so we strongly encourage you to do that. Please give us suggestions for new protocols. And please give us corrections to old protocols because there's plenty of editing to do, right? These are a work in progress always. That's just the function of the thing. So if you see things that are wrong, that need updating or correcting, please go to the website and let us know. This website is also on the Fort Drum Regional Health Planning Organization website. And probably on all of the regional websites, honestly. If you look for something that says change protocols or suggest protocols and hit that button, it's all going to get you to this REDCAPS site.
Absolutely, it will, Tiffany. And on the Fort Drum Regional Planning Organization, it'll be the last blue button on your left-hand side as you're looking at it.
Awesome. Thanks, Ann. So we are doing the Epistaxis training. Who do you have with you? This is Ann Smith. She's down in your little box right now. And she is a paramedic at Tri-Town and at Lisbon Fire. She's the Fort Drum Regional Health Planning Organization North Country EMS Director. That's a lot of words and a lot of job, and she helps us out a lot. So please, everybody, get to know Ann because she is the new Travis. Yay! So things are moving forward and lots of changes. We don't like change, but we're going to have to live with it. And it's good change anyway. I think we're all growing. And this is me. I don't have any conflicts either. I'm a physician at CVPH and at Messina. I'm the medical director for Plattsburgh City Fire and for the Elizabethtown Community Paramedic Program. I'm the medical advisor at Whiteface, and I'm the REMAC chair. Okay. So objectives. As with any education that you devote your time to, really the objective is that you master it, right? That you have it as part of your soul for the rest of your life, or at least for the short-term future, which would be 6 months and 6 years, right? This is stuff that you need to be able to use to treat your patients. So if your brain is in catch and release mode, right? Like you're sitting here listening to this edutainment and you're going to take a little quiz and that's as far as you're going to remember it, you're kind of wasting your time. Don't let your brain go there. Right? Let your brain go into, hey, this is something that I need to absorb, that I need to be able to teach somebody next week and 6 weeks from now and 6 years from now, right? Think about it there as you're learning it, and that's where it'll go. But don't put it in your catch and release file because you could be doing something else with your time if that's what you're doing. So we'll think about epistaxis anatomy and triggers for epistaxis, which may or may not be what you would think, and treatment of epistaxis, which is really easy. So we'll do anatomy first. Turns out there's really two kind of major geographic sections of the nose that we need to know about. So there's the posterior nasopharynx, this big pink area here, and then there's Little's area, which is the squishable part in the front, okay? So anterior nosebleeds are much easier to stop than posterior bleeds because all of this area back here is protected by bone. So much more difficult to get at, but maybe much more helpful when we have some adjuncts, which is what we're learning. So this part up here is the anterior, this part back here is the posterior. The anterior part is also called Little's area, and it's the part that you can squish with your fingers. So triggers of nosebleeds. This is the biggest one. So nose trauma, usually from sticking something up there, sometimes from bonking your nose on something, right? But those are usually pretty easy to control because they are from trauma that's at that squishable Little's area. Also dry air and non-humidified nasal cannulas. I know we never see those except every single day, right? So these are the most common ones. And then occasionally you'll have tumors in the nose that can start bleeding. allergic reactions and other inflammation of the nose, people that are having hay fever symptoms or allergic to whatever's blooming this week, that are sneezing, 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 blowing, blowing, blowing their nose, end up just causing some abrasion in there, and that can cause it to bleed. Something that I was led to believe earlier in my career was that hypertension would cause nosebleeds. I don't think there's good evidence for this. I think this is more of an old wives' tale. And the reason I think that is not because I've read any great studies, they're probably out there, but because I see a ton of nosebleeds in the emergency department. They all come in hypertensive, almost all of them, and sometimes quite significantly so, like up into the 200s. And as soon as I get their nose to stop bleeding, their hypertension goes away, which says to me that the hypertension is probably reactive to the situation and the stress of the nosebleed, rather than actually a cause of the nosebleed, at least most of the time. But again, I see this over and over and over, and I think I've yet to see a patient whose hypertension didn't resolve or at least significantly improve after we stopped their nose from bleeding. So interesting to know. Treatment for nosebleeds. First of all, get all your gear on, right? Noses are dirty. Even if the patient doesn't have COVID, there's all sorts of other viruses roaming around that you really don't want, right? You don't need to be sick next week with whatever. So stick on your eye protection. Don't get their blood in your eyes. That's a whole nother situation you need to avoid, right? Put on your N95 and your gloves and stick something over your uniform shirt so that you don't get blood all over you. This makes sense, right? Okay. Now, step 2. If you're a critical care or a paramedic, you're now going to have the patient blow their nose and get rid of all that clotted blood that's stuck up there. And sometimes it's a lot, and that's okay. Sometimes there'll be like big worms of gross blood coming out. Totally okay. Just get it out of there because you need a nice clean environment in that nose to work with. Then comes the cool part. This is where you get to squirt the oxymetazoline, also known as Afrin or Nostril. There's a whole bunch of trade names for this. But the idea is you put 2 sprays up in both nostrils, both the one that's bleeding and the one that's not, right? Because usually it's just one. Not always, but usually. Okay. Remember to squirt straight back at 90 degrees, just like you're putting in a nasal airway. If you squirt upwards into the nose, sort of along the ridgeline there, you don't actually get it back into the posterior nasopharynx. So you need to get that squirt back into the head, okay? Straight back. And then this applies to everybody, right? Whether you are a critical care or paramedic or not, right? So now you slide your fingers down the bony part of the nose, start up at the top, push your fingers down until you get to that soft part, right? And then really pinch, and pinch hard. You want to pinch hard enough so that you're not hurting your patient, but you are making them slightly uncomfortable. That's how hard you want to pinch, right? So if you're not a critical care or paramedic, this is where you start. If you are a critical care or paramedic, have them blow their nose, squirt the oxymetazoline into both nostrils, and then pinch. Okay, and how long are you going to pinch? You're going to pinch for 20 minutes. Now, sometimes the patient can help you with this. Sometimes their hands and their arms and fingers are strong enough to be able to do this. Sometimes you're going to have to do this for them. Some people have some nose pinching devices. Just be careful of those. They tend to slide down off of the part that really needs to be pinched. So go ahead and try and use them if you want to, but watch them carefully because sometimes they slide down and become totally ineffective. Okay. But you want to hold for at least 20 minutes and then slowly, slowly, slowly release your hold on the nose, and then don't let them blow their nose, right? Tell them, don't blow your nose, don't sneeze, don't dab at this, don't wiggle it around, stop it, right? You want it to form a nice clot up there. Okay, so what's that sequence again? It's blow, squirt, pinch, and hold, and that's it. That's the whole thing, 20 minutes. Okay, so what is this new drug? It's oxymetazoline. Okay, it's also known as Afrin or Nostrilla or Sinex. There's a bunch of them. It's all the same stuff. It's a nasal decongestant. It's sympathomimetic, right? So it affects your sympathetic fight or flight type nervous system. And within that is an alpha-1 receptor agonist, right? So what does that do? It causes vasoconstriction. And because you're applying it locally, it causes vasoconstriction in the nose. Okay, will you sometimes get some bleed over effects from this? A little bit of tachycardia, maybe a little hypertension, maybe so, not a lot, and it's transient. This is the protocol here. So again, this is all the basics, ABCs, vital signs. Position the patient correctly, right? Like don't lean them back so that this all goes down their throat. That makes no sense. Have them sit up and forward. Okay. Pinch that area and reevaluate, right? So that is the CFR, EMT, and advanced stop. And then if you're a critical care paramedic, you're going to have them blow their nose and then 2 squirts of oxymetazoline and then pinch and hold. Okay. Peasy. So let's do this one more time and we're done. How many sprays? 2 sprays. 2 sprays per nostril, right? Block the other nostril while you're spraying. That's sort of intuitive, but maybe not always something we remember, but make sure when you spray in one nostril, block the other one. And if you can have them breathe in while you do that, that makes it even more effective. Spray straight back. Remember to go straight back. What's the medication? It's oxymetazoline. Oxymetazoline. There we go. It's an alpha-1 receptor agonist, right? Sympathomimetic. So what does that do? It causes vasoconstriction. So if this is the vasodilated vessel, you squirt and it constricts. Easy peasy. Okay. Where are we looking for? This is the area that you can squish. And obviously the posterior is not, right? But this is where you're trying to get your oxymetazoline to. You're trying to get it back there because you can't squish it and you want all the help you can get to try and form some blood clots up there. All right, what kind of epistaxis can you stop by pinching? That's the anterior and posterior nosebleeds are most benefited by the oxymetazoline, but you should try it for everything. Okay, often we end up having to pack those posterior bleeds. They're tough. What's that sequence? One more time. Blow, squirt, pinch, hold, 20 minutes. Okay, that's me squirting some oxymetazoline up some nice lady's nose. Let me take her picture. And notice that we're squirting straight back into the head, right? Not up. Okay. Do you need your PPE? Yeah, you need your PPE, right? Don't get all this germy blood all over you. That's disgusting. Don't do that. And that's it. Thanks, Mike Daly, for helping to review and edit these slides. Thank you so much, Ann Smith, for helping me out. Do you have any questions, Ann? Did I miss anything? Did you catch anything?
No, I think that was great, but I will tell you that it gave me some nightmares back to my childhood because now I think my mother was trying to do me in because she always made me pinch my nose and put my head back.
Yeah, we all learned that when we were kids, right?
Position.
Yep, sit them up. Sit them up. Don't let them drown in all that yucky, bloody stuff. Okay, awesome. I think we're done. Any questions, feel free to email me. My email address is also on the website. Thanks, everybody. Be safe.